Andrew Shapiro, general surgeon with Advanced Surgical Physicians. March is Colon Cancer Awareness Month, so I thought we'd take a couple of minutes to talk about colon cancer and why it's important to be aware about it. And something I say today may, and I'll say probably will, save somebody's life either in this room or that you know or love or care about. So listen to what I'm going to talk to you about and take that to heart if you would, okay? First important question, there's some of these on your table. Anybody have any idea what this is? That's nothing to do with colon cancer awareness, by the way. A mouse pad, I got one vote for a mouse pad.
I'm using a can opener.
It's not a can opener, it's not for a flip top. It is a jar opener. It can be multi-purpose as a mouse pad too, though, apparently. So please enjoy those. And I will let my marketing company know that they missed the mark on a jar opener and the mouse pad. All right, so a couple of things to review. Okay, so colon cancer it's expected that there'll be about 150,000 new colon cancer diagnoses, new colon cancer cases diagnosed in the United States in 2024. So 150,000 new cases this year, this country alone. And those 150,000 new cases and colon cancer in general will account for colon cancer, the second leading cause of cancer-related deaths in the United States. So breast cancer, very common, lung cancer, very common, but colon cancer is the second highest cause of cancer-related deaths. It's expected to cause about 53,000 deaths in the United States in 2024. So, pretty big problem. The rate of overall diagnosis, good news, it's been declining, but that's in the population over 55. We're actually seeing a 1% to 2% increase in new diagnoses in patients under 55. We really don't know why that is, but it's being diagnosed at a younger and earlier rate over the last 30 to 40 years. Some of the signs and symptoms of colon cancer include a change in your bowel habits. It's not necessary to go every day. If you don't go every day, and you go every other day or every third day, and that's normal for you, then that's normal for you. If you go every day, and all of a sudden there's a change, that's a change, okay? If your caliber of your stool is 1 diameter, and all of a sudden it becomes more narrow or ribbon-like, that's a change. If there's any blood in your stool, that could be a sign or a symptom as well. Unexplained weight loss, so if you're exercising, you're working out, you're watching what you eat, and you lose weight, that's expected. If you're living your normal life and all of a sudden you're dropping pounds for no reason, that's a problem. You probably want to get that checked out. Okay. The last thing is some abdominal pain or discomfort. Those can be some signs of colon cancer. As you can see, it's as we said, it's being diagnosed more commonly in younger people. It's killing a lot of people, but the good news is that it is preventable. It's one of the most preventable types of cancers that we see, okay? And the reason it's preventable is because you can do certain things, number one, to modify your lifestyle to be healthier. So eating a healthy diet, fruits, vegetables, fiber, avoiding processed foods, limiting your alcohol consumption, not smoking, maintaining a healthy weight. Those are all things that help reduce your risk of developing all cancers, including colon cancer. The other thing that we can do is we can identify precancerous polyps and treat them before they turn into cancer, allowing us to prevent you from developing colon cancer. Colon cancer is preventable, and early detection saves lives. So if you'll all entertain me for a second, stand up, please. A couple of questions. Okay? If you don't feel like doing this, obviously don't do it. But if you're under the age of 45 and have no first-degree relative with colon cancer, so meaning neither of your parents, any siblings or children, if you're under 45 with no first-degree relative with colon cancer, you can sit down. If you are 45 or older and have never had a colonoscopy, you can sit down. Okay? So for everybody else that's standing, I'll give you the name of a GI doctor you can see for colonoscopy. Because you need a colonoscopy, okay? Thank you, guys. So screening for colon cancer. Colonoscopy, in my opinion, is the best way to screen for colon cancer. It's a procedure. It's done under sedation. It's relatively painless. You're sedated for it. It involves passing a scope from below through the entire colon and directly visualizing the inside of the colon. And what that allows us to do is, number one, make sure there's nothing growing in there that doesn't belong there. Number two, if something is growing in there, they can remove it, do what's called a polypectomy, send that specimen to the lab for analysis, and determine what it is. If it's precancerous and it's been completely removed, then you'll probably go on a surveillance plan with another colonoscopy about 3 years. If it's completely benign, it may be 5 to 10 years. If it's clean as a whistle, then it's probably 10 years, okay? Colon cancer screening should begin at age 45 unless you're in one of those high-risk groups with a first-degree relative with colon cancer. That used to be 50. We used to recommend colon cancer at 50, but with the incidence and the diagnosis starting at a younger age, about 4 or 5 years ago, they decreased the recommendations from 50 to 45. So everybody should have a colonoscopy starting at age 45. There are some other screening tests out there besides colonoscopy. You may hear about CT enterography, which is where you drink some contrast, they give you some IV and you get a CAT scan. People say that's great, I don't have to do a bowel prep. With a colonoscopy, you have to do a bowel prep. I've had a colonoscopy. It's a lot worse in theory than it is in reality. Yes, you go like crazy, but you're clean, this doctor can see what they need to see, and it could save your life. CT enterography is a good study. There's some things called, there's some tests, stool tests. The most common one you probably see on TV is Cologuard. That looks for DNA material of cancer in the stool. So you collect the specimen at home, put it in the mail, send it to the lab. Somebody has the wonderful job of taking your poop and analyzing it, looking for that cancer DNA. It's effective, but I don't think it's the best study unless you're a prohibitive risk for a colonoscopy. The reason is if that study is positive, you need a colonoscopy to see if something's in there and then to treat whatever they find. Financially, with most folks' insurance, screening colonoscopy is included in your wellness, your health maintenance, preventative health. If you have a Cologuard and it's positive, your colonoscopy is now not considered screening, but it's diagnostic, and that falls into a different bucket of benefits that may be financially out of your pocket, or at least your copay or deductible or what have you. The other thing about the Cologuard is you have to do 2 tests if it's positive, right? If Cologuard's positive, you need a colonoscopy. If you get the colonoscopy, you're hopefully one and done. The other thing about the Cologuard is there's a false negative, right? So false negative means you get a result that says it's negative and it's not really negative, and then you think everything is smooth and clean and you're good to go, and one of these things develop and you go, what the hell, I had a negative Cologuard. So if you're 45 or older and you've never had a colonoscopy, get a colonoscopy. If you have any questions, I'm happy to answer them about colorectal cancer or surgery in general, but that's my PSA for today. Questions?